What's new for cholecystitis or an infection of the gallbladder? So, when you have an infection of the gallbladder, usually there's a stone or something blocking the exit. And when something is blocking the exit, you pretty much have this sac full of bile that can get infected. And when that happens, usually you develop right upper quadrant pain, fevers, and sometimes you turn yellow, called jaundice. But what can we do for that? So the gold standard is to have surgery. But some people present to the hospital late, and some people are just sicker than others, and they can't undergo surgery. So, what can we do for those patients? So, for patients who are not surgical candidates, right when they present to the hospital, we can do what we call endoscopic ultrasound gallbladder drainage. What that is we do an endoscopic ultrasound, which is a flexible tube with an ultrasound at the end of it. It enables us to see outside of the GI tract and identify the gallbladder, and we are able to stick a what we call a lumen opposing metal stent, or a stent that basically will adjoin the gallbladder to the GI tract. And thereby, we're able to drain the gallbladder into the stomach, allow it to drain out. The infection is then can get treated, and the patients do well. Eventually, we take out the stent in 3 to 4 weeks under an endoscopy, and we can even take out the stones if they're still blocking or still causing pain or discomfort. What else can we do? Now, there are radiological procedures called a percutaneous drain, where they do similar drainage of the EUS, but they do it through the skin, and that is done very commonly. But what's new on the block is that we're able to go over that drain and put an even smaller camera into the gallbladder after the drain has been in for about 2 weeks. We're able to use a special probe or catheter to blow up the stones into small little fragments and then take out that drain. This is paradigm shifting because people used to have these drains in for years, and they would just come in every 6 weeks and have the drain changed. Now we're able to do this, get rid of the stone disease, and take out that drain, which is really altering the way patients feel and definitely enables them to come free of this catheter that otherwise they would have lived 10 years with. So we're able to drain it internally or deal with it externally, but through collaborative care between radiology, surgery, and gastroenterology, we're able to really help our patients with gallbladder infections.